everyone.
Hello. So hello, we are back here today, every Saturday, 4 o'clock, 4点.
Yes, and Abengo today is going to share again knee pain part 2.
Yes.
So,
okay.
Those who have knee pain and then, but they really stretch out your quads, you feel like there's something more that leads to your knee pain. So do tag your friends and ask them to join. Yep.
So okay, so pass the mic to me already, right?
Yep.
Okay, so today Aben we're going to say what? So same thing, we're going to talk about knee pain again. Okay, so from last week what we had was we know, okay, yes, knee pain, degeneration, arthritis, no gel, no cartilage, but there are a lot more that contribute to your knee pain besides the cartilage. Okay, the one of the muscle is quadriceps. Okay, the quadriceps, the thigh muscle, quadriceps. Okay, now today we're going to and the quadriceps contributes during or contribute pain, reproduce the pain during going upstairs, standing up from the chair, standing up from the getting out from the car, getting out from squatting. Okay, now some people will ask, I got pain when I come downstairs. Okay, now today we're going to share with you another part of the knee, okay, that contributes or give you the symptoms of coming downstairs pain. Okay, coming downstairs pain. Now, so this is our part 2's model or the main key muscle for the day. Okay, so shall we start?
Yep.
Okay, so healthy aging. So again, according.
Before that.
Oh, okay. Disclaimer.
Yeah.
Okay, so our presentation today, all the text, graphics, images, information, okay, is for educational and informational only. Okay, so we do not responsible for any damages or any injury during the exercise. Okay, and the content is also not intended to a substitute for professional medical advice, diagnosis, and treatment. All right, always seek for the advice of your physiotherapist or qualified health provider. Okay, with the question that you have. All right. So next, so again, we talk about healthy aging. So according to WHO, healthy aging, the most important is maintain your functional ability. It means what? You can move around. Okay. Now, one of the most important function that we are going to talk about today is coming downstairs. Okay, or runner's knee pain. Okay, a lot of runners. Okay, not all. A lot of runners they grow some pain in the knee, and therefore they stop their run. Okay, and therefore they grow big increase in size or whatever. So today we're going to talk about one of the mobility that we need in the day is called coming downstairs. Okay, so next. So and okay, so this is our part 2 today. This is our part 2 today.
Series part 2 knee pain.
Yes, okay. Yep. So if you have friends who have OA, osteoarthritis, knee pain, arthritis, arthritic knee, X-ray, doctor say no more cartilage, or if your friends are eating glucosamine, okay, ask them, tag them. Yeah, tag them here. Yes,
and today also very special because we are giving out the one free foam roller, and we will find very useful for you.
Yep. Yes, it will be very useful. Yes, you are right. Okay, so our topic for today is we call it runner's knee. All right, later we will understand why we call it runner's knee. Or another way, the mobility that we mentioned today is coming downstairs pain. Okay, so next. Okay, so what do you know about knee pain? Everyone got knee pain, I also got what? Okay, but the question is how? Yeah, everyone, right? Unless I don't have knees, you don't have legs, don't have knee, then no knee pain, Okay, so what do you know? Okay, so next, let's talk about our myth first. Now, the first myth we mentioned already previous live. Okay, so does exercise matters? Okay, I exercise regularly, yet I have knee pain. I don't exercise, yet I still got knee pain. Okay, so what is the answer for these two questions? Very simple. Muscles. Muscles is the answer. Okay, so muscles, stiffness, and causing knee pain is the answer. All right, now today's myth. This one is last week one. Now today's another myth, second myth. today's another myth. Second myth, people will be
Body
quite,
weight matters?
yes, okay, people will always ask, does body weight matter? A lot of people will ask, I'm too fat, that's why I got knee pain. Okay, now I tell you, okay, overweight, I got knee pain. Okay, lor, if you say body weight matters, then now I ask you back, people like Shu Hui, she's thin, why she still got knee pain?
I also got knee
Okay,
pain.
yeah, so again, answer is not your body weight. All right, it's your muscles again. Muscles. Okay, now how we explain that? Okay, later we'll explain it later. Now again, that means what? You have knee pain today. You reduce your body weight does not mean that you can cure your knee pain. Okay, but body weight is still not a good thing. Okay, you still need to think about it. You have to follow the our Malaysia or Asia's BMI. Yes. Okay. So over here, disclaimer again. Over here, I did not say you don't need to reduce your body weight if you are overweight. Over here, I only say that yes, you're overweight, yet you still got knee pain. You are not overweight, you still got knee pain. Because weight does not contribute the major contribution to your knee pain. It's a muscle, it's a biomechanic. Okay, but body weight does matter. Okay, good. So we have a few more myths. Follow us, then we will try to explain to you more. Okay. Yep. So next.
And Vivian said she got the knee pain. She said, "So I am fat." No, not necessary.
Yeah, not necessary. Okay, and so what BENPHYSIO says, and this is what we showed last week also, we do respect degeneration. Okay, we do respect, and next slide please. We do respect degeneration, and we do respect osteoarthritis because it happens when the age comes. All right, and the changes on the structure may not be irreversible. Okay, may be irreversible, but we believe by doing a proper correct diagnosis, you still can bring the pain to the minimum. Okay, with optimal movements, with better quality of life. This is what BENPHYSIO always try to say. Okay, so next, and our topic. Okay, so again, whenever you go and see your physios, make sure your physios ask you, mana itu sakit, where is your pain? All right. Second, what movement caused the pain? Going upstairs, coming downstairs, squatting, getting out from the car, okay, or sneezing also cause knee pain, something like this. Okay, and the physio should be able to tell you what is the mechanism for knee pain. Okay, how is the mechanism works? And lastly, what structure is involved? Because why? We will give you homework. Go home, loosen the stiff muscle. So you need to know what structure is involved, what structure is or what structures are involved in the knee pain. Okay, good. Next. Okay, this one is today's main one. So actually today is our topic. We call it runner's knee, okay, or we call it ITB problems. ITB is a name of a muscle, okay, iliotibial tract, iliotibial band, ITB, okay, or we call it runner's knee. So the reason why it names it under runner's knee because it happens in runners. It happens in runners. Okay, now, so in this slide, we're going to talk about the symptoms of the knee, the type of knee pain today. Okay, number one, going downstairs. Okay, now, our audience, just a simple question. Now, look at the first lady on the left. Okay, the one, I think should be lady, right, wearing the high heel one.
Yeah, lady. So
now, she is coming downstairs. Now, my question is, when she come downstairs, this question no give one. This question no give one. Okay, now my question is, when she comes down the staircase, right, the lady on the left, you guess which leg is the one suffering the pain? Okay, the one in the front or the one behind? Okay, very quick one, 3 seconds. 3, 2, 1. Okay, the answer is the one behind. All right, when people say coming downstairs, normally people are referring to the leg behind. Okay, the leg behind, because as they are slowly lowering down their body, okay, to reach the next step lower, all right, that's where your knee starts to hurt. Okay, this is what we call the coming downstairs pain. Okay, and somehow some elderly, right, they are very smart one. When they come downstairs, they don't come down this way down one. What do? They come down like sideways, like a crab coming downstairs. All right. So again, if you saw some elderly or your house has some elderly, walk down the stairs, reverse down or sideways down, tag them. Tag them. Okay, elderly, tag them or your parents. Okay, why? They are having this problem. Okay, there's a reason why they feel more comfortable going downstairs backward or sideways because they are in pain. They can't tell you or they don't tell you because they already changed the way they move, but they are in problem. Okay, so that's the number one symptoms for today's problem, ITB. Okay, remember the word ITB, all right, iliotibial tract or iliotibial band. Okay, so second, we call it runners knee because it happens in runners. Now, if you look at the pictures in the center, like the runners, all right, again, my question here, no give one question. Which knee is the one suffering the knee pain in this picture? Okay, 3 seconds. 3, 2, 1. Okay, the answer is the left knee. Okay, in the picture here, the left knee. Why? We call it landing knee. Okay, runners have the knee pain, okay, due to ITB. It's normally because of the landing phase. The moment their feet touch onto the floor, okay, landed on the ground, that's where their pain is. So we call it running pain, or we call it runner's knee. Okay. Now, some people like to go hiking recently because KL there are many hills around, Apet San, TTDI PJ, Gasing Hill all right. Now, when you climb up hills, you use a lot of your quadriceps. This is our last week.
Yep.
All right. Okay. Now, if once you go up here, you need to come down, isn't it? Like you sit helicopter and come down, right? Yeah, so when you come down, you find that, how come I come down here, I got knee pain, pula? So this is again, we call it ITB. Okay? Okay, so these are the 3 common symptoms that ITB giving problem to your knee. Coming downstairs, coming down hills, and landing during running. Okay?
So the first is all climbing up one. And then the ITB is all like landing and going downwards one.
Yes, you are right. Okay, this is how we segregate law. The different muscles play the different role. Of course, they can be mixed. They can be combo. Maybe Shu Hui today come right. Ayo, Ben, I got going upstairs also pain, coming downstairs also pain. No problem, Shu Hui. Congratulations. You have both quadriceps stiffness. You have both ITB stiffness. Yeah, okay, this is what we do. Combo. All right. So stay tuned with us. When it comes to the knee pain part 4, part 5, then you may find, I may have combo 5. 1, 2, 3, 4, 5. All 5 got problem. Also possible. Okay, so yeah, so now next, how we explain how ITB give you pain. All right, very simple. If you look at the first photo right on the left hand side, all right, when you are coming downstairs, that means what? You are doing a mini squat. All right, now when you are doing a mini squat, right, this is what you see. Your hip will go into internally rotation and your knee will go into adduction. All right, whatever it is, not important. The most important is look at the knee. Look at the knee on the left picture and look at the knee on the right picture. Okay, so what you can see here is that your knee on the left picture is pointing inward. It's pointing inward. And the knee on the right picture is facing your face now. The knee on the left is pointing inward. The knee on the right is pointing to my face and to my nose now. Okay, a good ITB workout, a good knee with a good ITB should be the picture on the right, whereby when you come downstairs, whereby when you have a mini squatting, it should be pointing in front. Okay, now one of the reasons why your knee is pointing in front, not pointing in front, 2 reasons. Number 1, stiff ITB, or number 2, weak ITB. Okay, now today I'm not going to teach everyone how to differentiate stiff and weak. Okay, I will just here to differentiate stiff ITB. Okay, because weak ITB, you need to learn how to make it stronger. Okay, but today we'll just teach you ITB stiff and how to loosen the ITB. Because ITB weak one is a very long story. We will say next round. We will explain next round. Okay, but most important is this is a mechanism why coming downstairs got knee pain and it is ITB. Okay? Okay, Shu Hui, you can come back. Okay, so next. Mana itu ITB ya. Okay, so actually ITB is something, the big blue circle. The big blue circle is the ITB. Okay, the big blue circle, the white color thing, we call it ITB. Okay, it's just right in the side of your thigh muscle. Later I'll teach everyone how to feel it. It's just right at the side of your thigh muscle. Okay, and this ITB very exclusively, right? It has two muscles attached to. Muscles number one, if you look at the small blue circle, okay, we call it latae, tensor fascia latae. Okay, in short, we call it latae. And another muscle we call it gluteus medius. In short, we call it glutes today. Okay, so ITB has two muscles attached to it. Number one, latae. Okay, number two, glutes medius. Okay, so this is where is ITB. Okay, now you may not able to imagine, right? Hey, where is my ITB? Now I show you the real photo. Okay, everyone take out your pants, remove your pants. Okay, remove your pants. Wait, remove. Yeah, I'm wearing long today. Okay, now I show you the picture. Now everyone, if you have your tie with you, right? This is your knee at the side. Okay, so if you can see ITB, right? You can see a groove here. We call it a groove here. Okay, this is your ITB. All right, just right at the side, middle of the side. Okay, this is what we call ITB. All right, so what you need to do now is just put your two hands at the side of your thighs. Okay, the two hands at the side of your thighs, and then you try to press it. You try to press it and feel it. Okay, do you have pain or do you feel sourness, swing, sourness, asam? Okay, you try and feel it. Sorry, Suhei.
Painful.
Painful. Okay, so you will find that there will be one side more painful than another side. Okay, just put your hands at the side of your thigh and then feel it. One side you feel there is one tali one or one thread. Okay, guitar string. Okay, another side maybe have lesser. All right, that is your ITB. Oh, okay. So wait, next picture, next slide. That will be telling us about the ITB, the position of the ITB.
ITB groove.
Yes, this is the ITB. You call it ITB groove. If you take out your slower, right, your pants, right, you will see the ITB groove already. That is a groove. This is what we call ITB. All right. So if your ITB is stiff enough, you should be able to have a very visible ITB groove. Yes. Okay. So this is ITB today. So, okay. So ITB. So now this is my knee. Okay, this is our knee for today. This is my right knee. Okay, how I know it's knee? Very simple. This little bone is on my right. Okay, so it's this is my right knee. Okay, so basically, where is ITB? ITB is running at the side here. Okay, it's running at the side here. Okay, so ITB is running. Okay, it's running at the side here, at the side of the thigh, at the side. Okay, so now when this ITB pull, okay, it will pull you up towards the right, and it will move your kneecap. Okay, when there's a lot of excessive movement in your kneecap, that's where your kneecap will have wear and tear. All right, this is how the ITB works. So therefore, you can understand if ITB keep on pulling, or we call it yanking at your kneecap. Okay, there will be two locations always have problem. Location number one, where the ITB area is, we call it outer knee pain. Okay, outer knee pain. And number two, because of the movement of the kneecap, another pain will be at the inner side. Okay, next slide. We go back to the slide. So this knee joint will tell you and explain to you where is the location of the knee pain. Number one, inner side of the calf. And number two, outer side of the calf. Yeah, this is a typical ITB pain. This is a typical ITB pain. Of course, you also can hear some cracking sounds. All right. So therefore, not only quadriceps will give you cracking sounds, ITB also can give you cracking sounds. But now, Suhei, I ask you, when will you hear the cracking sounds? Go upstairs or coming downstairs for ITB?
Go downstairs?
Yeah, should be go downstairs, because you were saying my ITB is giving you problems during coming downstairs.
Going down.
Okay, going upstairs, you feel the cracking sound, that is your quadriceps. Coming downstairs is your ITB. All right, we just make it simple that way. All right, can it be mixture? Yes, possible. It could be mixture. I told you already, you can buy a la carte, you also can buy combo. Your knee also can have combination. Okay, ITB plus quadriceps problem. Okay, and some people may feel, oh, I feel weak to go upstairs. To go downstairs. I feel weak. Last week we said already, when your quadriceps is tight, you feel weak to stand up or go upstairs. Now today, if you feel weak to come downstairs, again, it's telling you ITB problem. All right. So why there's a pain?
Like the knee giving away, is it?
Yes. Okay. Yeah. Giving away. Yes. Another reason. Okay. Giving away. Okay. So again, if you're very familiar with ITB, this is how it works. Okay. Outer pain, inner pain, feel weak when you come downstairs. Okay. And again, all this pain is due to the scarring. We call it the scarring. Scars around the kneecap. Okay. Yeah. Also, we call it scarring. So when you come to see physio will do a little bit something on your scars. Okay. Because scars we can remodel the scar into a better way. Remodel the scar. Okay. So therefore, we do some scar mobilization to remodel the scar. All right. Yep. Okay. So this is the ITB location of the pain. Okay. So just now we were saying, ITB got a muscles attached to it. Okay, we call it lateral. Hey, next slide, Ashui. Lateral. All right, now something very weird. If someone with ITB problem, right, they may also have some pain around the hip area. Okay, if I stand up, somewhere around here. Okay, around here, this is where the lateral is. This is where your lateral is. Okay, so some people, especially elderly, okay, they always have some pain around there. Numbness, pain, sourness, asam around there, a lateral area. All right, so it also could be an ITB problem. All right, now young children also often have problems around this part. They will tell you, right, oh, when I walk, right, I feel clicking in my hip. They feel clicking in my hip. There, this is the answer. Okay, so if any parents, if your kids ever tells you that, hey, I heard some clicking in my hip when I walk. When I walk, no pain one. Okay, young, clicking sounds, bring them to see physio. Why? ITB got trouble already. Their ITB got trouble already. Okay, yep. So this is a feature of ITB. Because why? Just now we say already, ITB got a special feature. It has lateral at the front, and it has a glutes medius behind. Okay, so that is my ITB pain location. All right, now whoever wants our slide. Yeah, sorry.
Yeah, just now you say the area is just beside the groin area, is it?
Yes, it's just beside the groin area, but it's more the outer of the thigh muscle. Okay, so I think Suhui, we are giving away our slides also, right?
Yep, you can just comment slides if you want our slide. We have all these very nice anatomy pictures.
Yes. Okay. Because why? I think sometimes we are too fast here. So some people, they want the slides so that they can review the exercise easier. All right, especially all these location special one. So at least they can keep 1 or 2 slides over there. Okay. Yep. So we finish our this knee pain location. Anything related to ITB is just around there. Okay. And why they have this sourish or feel weak to put weights? Because of some nerve irritation. Okay, on our this TFL lateral, right, there's some nerve, okay, passing by. So that's why it gives you some irritation, sourish feeling. Yes. Okay, so next, okay, we're coming to our almost end already. Yes, so I already know, right? I come downstairs, okay, Shuhui, come downstairs, what problem? You come downstairs, got knee pain, ITB. If come downstairs, got cracking sound, no pain, also ITB. Okay, if I feel weak to come downstairs, also ITB. Yes, if I feel sourish around my hip area, groin area, also your ITB. Of course, to be more precise, is your lateral. All right. So now next, we're going to teach everyone how to stretch your ITB and glutes medius. Okay. So basically, if you know, right, ITB is just around your side of the thigh. If you know, all right. The best and easiest stretching side, which I always do, is cross leg. Okay, the key is cross leg. Now, if you look at the first photo on the left, just cross the leg. All right, you just cross the leg and then you use your opposite arm to pull it. You will feel it already if you have ITB tightness. Okay, if you cross the leg, you use the opposite hand to hold it. you will get it already. Okay, so you can do it like the photo on the left. All right, or you also can do it like the photo on the right hand side. Again, the key is cross the leg. See, you just cross your leg, you can feel it already. Okay, so this is how the ITB works and how you stretch your ITB. Okay, so some people say, yo, I have a little bit difficulty to go down to the floor wall. Can I do somewhere else? Easy one. Oh, sorry, the next slide also not easy one. Also need to go down to the floor. Okay, next slide. So some people morning wake up, I want to do ITB stretch, can or not? Can. You can also do like what the lady do lor. Again, the key is cross your leg. Okay, so she crossed her right leg, she used her left to help. That's all. With the knee bent. All right. If I think I want to do a little bit more, I can even straighten my knee. Okay, both are doing the same thing, everyone. Our dear audience, both are doing the same thing whereby I'm stretching my IT band as well as my glutes medius. All right, it's just that with the lever with the knee bending or with a longer lever with the knee straightened. It's up to you. All right, whichever you feel nice and comfortable, go ahead and proceed. All right, okay. So some people say, oh, can I do it in office? Office no bed, how? All right, or can I do it in the field when I go to exercise? Can. You can do something like what the lady on the left in standing. Okay, in standing. Now, this one on the left one, right? Now, this one a little bit tricky. Now, if you want, okay, she is stretching her left ITB. Now, if you want to stretch your left ITB, okay, make sure you put your left leg behind your right leg. All right. If you want to stretch your left leg, okay, left leg, okay, you put your left leg behind, cross it over, okay, and then only you bend your body down towards your right side. Then only you bend your body down towards the right side, as like in the slides. Okay, so this is how.
Cross your leg towards the opposite side behind.
Cross the left leg, the leg that you want to stretch. Okay. Cross it behind. Yes, okay, that's where you can stretch. Okay, yeah. So some people, I cannot do it on the bed, also can. There. Okay, now this one is in the long lever. Straightening one, long lever. Okay, so this is how you stretch your ITB also, okay? And the one on the right is a lot more easier. You just lie down there and tangle your leg. Then you can get it stretched already. Okay, then, so that is the one.
Yeah, Ben, if I stretch, right, when I feel like the side there, like there's some numbness, is it okay to stretch?
Okay, if there is a numbness, as we mentioned just now, yes, possible. All right, so if the numbness does not get worse, fine. If the numbness get more worse, maybe you don't want to go to that extreme. You pull back a little bit.
That is because too tight already, is it?
Yes, because of the muscle a bit too tight. Yes. Okay.
The next one will be the foam rolling one.
Foam roller, yes. This is our free gift today, no? So now the free gift is inside the picture already. Everyone take the slide. That's a free gift. Okay, so we have foam roller. Okay, so again, same thing. So you can use your foam roller to foam roll your ITB. Okay, what does foam roller do actually? Foam roller is something like a self-massage lah. So you sit on the foam roll and you know already where is ITB ma. So you just sit on your foam roll, okay, with your ITBs on top of the roll, and then you just roll yourself side to side. Roll yourself side to side. Okay, that's where we call it self-massage on the ITB. Okay, this is the first picture on the left. All right, now if you follow the guy on the right hand side, so the guy again, our key is cross the leg. So the guy is doing the stretching by crossing the leg. So he just sits there, a very nice spot, one very sourish and nice spot. This is what we call the glutes medius. Yeah. Okay. So there are many ways to stretch the ITB, not necessarily only one. The most important is you find out already you got ITB problem, your ITB is a troublemaker, find a way to stretch it. That's the most important. Okay. So foam roller is one of the way. Okay. So all these are few small examples. If you want more pictures and videos, you can also Google. You also can Google. All right. Okay, now last. Okay, so actually at the end, what do you expect? Okay, I got coming downstairs, I got a few weeks. Okay, now after 2 weeks of all these stretchings, if good enough, okay, and your diagnosis is correct. After 2 weeks of doing all these stretchings, you should feel different. You should feel stronger when you come downstairs. You should feel that the cracking sounds on the knee is lesser, right? You should feel that you are more stronger, lesser knee, knee cracking sounds, or even lesser pain. Yeah, it should be that way. All right. But again, if you do not see the outcome that you wish, come and see us. Because why? It could be combo. Combo more than one muscles, or maybe somehow your scarring is a bit too much. You need someone to do the release for you. Okay. So therefore, if you're doing it correctly, you see, that's why physio is very amazing, right? If you do it correctly, you should see the difference. You should see the difference. Okay. So what should you expect? Of course, to be better, to be better. Okay. Initially, come downstairs, got problem. Better, no more pain no more pain or no more cracking sound when you come downstairs. All right. And then last one. So
yeah, we are giving out free foam roller.
Yes, okay, we are giving out free foam roller today.
Yep, you have to tag your friends, and Mr. Ben, we're gonna give you one question.
Ben. Yeah. Yeah, we will throw you one question. The question should be very, 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 very simple.
Simple.
Yeah. Okay. So I have pain when I'm coming downstairs. I feel weak when I come downstairs and downhill. All right. I have pain at the outer knee. Okay, during running, during landing phase. What muscles contribute the pain? Okay, my question. Okay, so what muscle contribute the pain when I land my leg during running, when I come downstairs? Okay, when I feel sour when I feel weak when I come downstairs. So what is the muscles that give me problem? Okay, so that's my question today.
So what is the muscle or the band that gives you
yes. Okay, so the muscle, very simple. So we stay here for another 2 minutes.
Yep. And while waiting for 2 minutes, of course, because there's a lot of queuing up question for you, Ben.
Oh, okay. Oh, sure. Come, where?
Yep.
Let's go.
So the first one is about if there is cracking sound at the hip while walking but no pain. What about it?
Okay, so if cracking sounds in the hip, right? Can I know which part of the hip? Is you feel like it's inside the groin, or you feel like it's outer side of the groin? This one I have to clarify a little bit. So if you're inside of the groin, right now, that one is more to our hip problem. That is more to our hip problem. Okay, so we will talk about the hip grinding sound or hip clicking sounds in our future talk as well. All right, now if it's the outer side of the hip, right now, everyone, if you know, just next to your hip right there is a bone one. There's a bone. And underneath this bone, that's where your clicking sound. This is the bone. And underneath this bone, if there's a clicking sound when you walk, so this is what we call the latte problem. The latte will frictioning with your bone here. So there is a latte problem, which is again ITB problem. Otherwise, if it's the groin problem, it could be from inside. It should be from inside. That should be the groin problem. Yep. Okay, so we have to know where is the hip, so-called hip, which part of the hip. Okay.
So another question from Phyllis Mark. I think this one relates to the topic that we're going to share next week one. So she have a knee pain in the back of her knee, on and off, especially if I stand too long, cooking, or when after doing some yoga pose. So is it due to weak muscle or something else?
Okay, so normally we put it this way. Hold on, at the back. Okay, so at the back of the knee, yes. Is at the back of the knee, yes. Is a muscle that we call popliteus. All right, it's a muscle that we call popliteus, and we will present it next week. Yes, okay, Shu Hui was right. We're going to present it next week. Okay, and normally in our context, right, a lot of stiff muscles give us more problem than weak muscles. There are many times stiff muscles give us more problem than a weak muscle. Now go back to Phyllis' problem, right? Phyllis Mark's problem. Now, popliteus is a muscle just right behind your knee. Okay, and now this muscle gives you trouble because of your calf muscle. Okay, so this is what I can tell you lah. You have a very stiff calf muscles. Okay, now how I know if you have a very stiff calf muscle, or how you know? Very simple. Ask yourself, number one, do you ever have cramp at night? Okay, same leg, cramp at night. Or number two, all right, do you notice that your calf muscles are a lot more bigger than normal people and a lot more bigger than opposite legs? If there is, yeah, perhaps. Okay, that could be your answer already. Right, so next week we'll talk a little bit more about detail, because knee pain, a lot of people, when they have a sudden knee pain, okay, they will go and see a doctor. But my question is, when you have a sudden knee pain, does it mean that your knee suddenly degenerate until you have the pain? Actually, the answer is no. Osteoarthritis happen gradually. It takes years to happen. All right, if your knee suddenly have pain, that is not your normal degeneration process already. Remember, degeneration happens in a gradual process. Okay, if suddenly you have a knee pain, there, bottom there, sudden onset knee pain, next Saturday, I will explain to you why. It's a very, very, very interesting muscle, all right, but it gives you a lot of problem if you have it. Okay, so thank you, Phyllis, Mark. So stay tuned. Next week, we will tell you a little bit more on that.
Yep. Okay, so the last one. It's
sometimes when someone asking, right, constantly, sometimes when stretch bit have a bit cracking sounds. Okay, so if you stretch on the right muscles and it gives you a cracking sound, somehow I would say it's a good thing, because you stretch and you get the sound, it's fine. If you get the sound not because you're trying to stretch, but because you're trying to do something, walking up, going down, then it's a problem. If you stretch and you get the sound, fine, and eventually you find that your movement will be better, and that is fine. Okay. Just that sometimes I lift up my hands, crap. After that I feel better or looser. It's fine one. It's okay one.
Okay.
And constantly say it was outer side knee. Yeah, so it's correct lo. It's the ITB lo. Outer side knee. Okay. So somehow constantly, so most likely it sounds like you are having ITB problem lah. So I think there's one more question as well.
Yep. Pain from Feng Yi Lim. So pain at inside of the knee when squatting down. Is it because of ITB problem?
Okay, so I believe what she's mentioned, squatting down here, is fully squat, right? Now it's a fully squat one. It's not what we are talking about today. It's the next week's topic. It's the next week's topic. Okay. So it's a muscle called popliteus. If you are talking about fully squat down, so it's a popliteus. Feng Yi is a popliteus. So again, it's a calf problem.
Okay.
Okay. So stay tuned next week.
Stay tuned next week. Ben sharing series again.
Thank you. Thank you, Suhui.
Thank you.
Bye-bye.